Okay, we're going to look at the procedure section for IntelliChart. So we go scroll down here to procedures. We're going to add a procedure. So we'll say we're injecting lucentis and right eye neovascular AMD with CNV. And then we'll say we're going to have another one. We'll say lucentis 0.3 OS diabetic macular edema. So oftentimes it is the job of the technician or the scribe to prepare this as they are preparing the patient for the injection, and they will fill this part in. And so oftentimes we will be after that working on another part of the chart, trying to complete the chart as the patient's anesthesia is working. So we may be doing completing the drawing and inserting it, or working on the impression and plan. And the chart usually does this when you click off to another section. It will shut down the procedure section. You can bring this back up by pressing that. But more often what happens is I will check the procedure to verify that it's done. And in this section here, it becomes difficult to see what the injection was given for. I can see up here that the injections were given, or at least recorded for each eye properly, but the associated diagnosis is not up here. And while it is in here, and the first one's pretty easy to find because it's close to the front, the second one is very difficult to find. It's usually buried somewhere down in here, and you have to look for it right here. So this is one thing that I like to check as I'm completing the chart, to make sure that the proper diagnosis was associated with the injection itself. It would be nice and much easier to do that if in this dialog box, or this window here, the diagnosis was in bold, so that I could just see right here. You'd just be able to see neovascular AMD with active CNV, and down here see diabetic macular edema. And those would be the two main things that would be bolded. Those are the most pertinent things that I'm going to be looking for to check here. I can check what the medication was and its dosage by looking up here. I don't have to. It's not as big a problem when I'm looking for Avasta and Lucentis or Eylea down here, because I can see it in the summary. But the diagnosis that's associated with the procedure, it really would be helpful if it was bold in here, so it would be readily visible in this kind of summary report here.